Station. Good morning. Good morning, Nigeria. Good morning, Dipo.
Good morning, Carla.
Another hour until we say good afternoon. So for
Mhm.
now, good morning to you. Hope you have a good week.
Yes, I did.
And
I did have a good week working here. Doing what you love every day. It was
exactly.
an amazing week.
That's the best thing to
Did
do.
you have a good week?
I did. I
Yeah?
had a very actually time flies so quickly. It's amazing these days.
Okay.
It makes you think. Are you making the best of your time sometimes?
It's so in a funny way. People always say January is the longest month, but
You
somehow
think?
this one feels like it wasn't that long.
Speed of
So
light, people. Speed of light. I don't know how this is slow but or long, but it's speed of light. I can tell you that. Anyway, welcome to the show. Welcome everyone. My name is Carla, and once again, welcome to the Health Station with Dipo and I. And today we are opening a special case, the case on endometriosis and how it affects us here in Nigeria and what we should know mainly about it. And today with me, I have a special guest. He is a medical doctor, general practitioner, aspiring psychiatrist, mental health advocate, and vlogger on social media as at dr.tm underscore the medical truth. We will be posting this on your video if you're watching us on Facebook. So we're streaming live right now. So you'll have more information on him. He also loves to teach through his videos in a very simple, how can I put it? In simple terms, so that any person can understand and learn more about it. And he also helps create public awareness regarding many health issues plaguing Nigeria and Africa and all. So I am honored once again to have him back on the show, Dr. Tochukwu Macaulay.
Good morning, Carla.
I'm so happy to have you back.
I'm so happy to
It's
be
been
here.
a while. We were talking about that. When was the last time you came on the show?
That was in April
Yeah.
last year.
So I think we should make this more often.
Yes, definitely.
Especially what I love about you, Dr. Tochukwu, is that the way you explain, most of the time, anyone can understand. And this is exactly why you're here on the show.
Exactly.
Because the people want to learn and the people need to have it said simply on simple terms so that
Very
they can
easy to understand.
exactly
Yes.
we can all go into literature, we can all do some search on our own, but sometimes you need someone who gets it the way you do in
Exactly.
order to understand it. So welcome
Exactly.
to the show.
I'm very happy to be here.
Exactly.
You look very lovely
Thank
this morning.
thank you. I'm being told so every day.
Yes.
Depo, you didn't say
Yeah.
anything about me today.
you look. I agree with Dr.
I am
Tochukwu.
such a woman. am I not? All right, so let's start straight on our topic for the day: endometriosis. What is it? For those of us who hear it for the first time.
Okay, endometriosis is a medical condition that primarily affects women. It's characterized by presence of normal endometrial tissue. What do I mean by endometrial tissue? The lining of the womb. There's
Okay.
a lining, there's a tissue, there's a skin that covers the womb. When you start to see that lining abnormally implanted in other locations apart from the uterus, that's the womb, that is just what is referred to as endometriosis.
All right.
Okay. And the thing is that most times the endometrial tissue, that's the endometrial lining, it gets implanted in other female pelvic organs. Most commonly, the ovaries and the fallopian tube are affected.
So not just the lining of the womb, basically. It could go beyond where it started.
Yes, exactly. Other times, it could be the vagina, it could be the cervix. Very rare cases, very severe cases, you might start to see that endometrial lining in the lungs, in the pleura, in the brain, in the skin, the diaphragm, the kidneys,
Oh,
all
wow.
the way up to that place, the bowel, the bladder, the stomach. So that's why it's very important for us to really, really talk about endometriosis. Now, the tricky part of endometriosis is this. The endometrial tissue, that abnormally implanted endometrial tissue, it has the capability of responding to normal hormonal and menstrual cycles.
All right.
So that just means that as a woman bleeds during her normal menstruation every month, her normal period, wherever that abnormally implanted tissue is, will also start to bleed.
Yeah.
So you
Wow.
can imagine a woman who has abnormally implanted endometrial tissue in the lungs. What's going to happen? She's going to start to bleed.
Definitely. Internal
and cough
bleeding.
cough out blood.
Yes.
And that is what referred to as cyclic hemoptysis. Sometimes, if it's located in the brain, it could lead to catamenial seizures. So, endometriosis is not a funny disease. It's definitely not a funny condition.
And it is quite common, isn't it?
Yes, it is. It's common and poorly understood.
Yeah.
That's just the thing.
And this is what we're going to get to later. But back to the definition of endometriosis. So you were speaking about implants or patches of endometriosis that can develop in places other than where it started. It could go from ovaries to lungs, arm, as you said. Another thing, what are the complications that could come? So you spoke about coughing blood for the extreme cases. But for a woman, do all women have symptoms to start with? Are the symptoms there? Can you have endometriosis without having a symptom?
Yeah, endometriosis can occur in any woman.
Yeah.
There is no particular tribe or race or ethnicity that is affected.
All right.
Reports have shown that 30 to 40% of women, Nigerian women, suffer from endometriosis, and then 11% of that are unaware that they have the condition. Why? Because they don't even have symptoms at all. They are asymptomatic. So other studies, other reports have shown that as of 2015, more than 10 million women were affected by endometriosis.
Wow. Okay.
So it's a very common but yet poorly understood medical condition.
All right. Okay. And as for complications, once again, let's think of during the periods, the menstrual cycle, the pain. Some women complain of excruciating pain.
Yes, excruciating.
And some people might ignore this and think it's just regular pain.
Yeah, the thing is, what happens in endometriosis is that there's severe pain. And the truth is that many medical experts, they feel that patients who suffer from endometriosis, they are very likely to be misdiagnosed, to be misinterpreted. They're not taken seriously.
Yeah.
If you have watched my last video on endometriosis on my Instagram profile page, I talked about a woman who had symptoms of endometriosis, very severe pain during her menstrual flow, during sex, during sexual intercourse, during ovulation, but it was not recognized on time. Many misconceptions. So people believe that the severe pain encountered is just normal. It's a normal symptom of menstruation. You have severe pain during your menses, it's normal. Just go take Panadol and it will go down.
Wow,
that's the problem.
Quick fix.
So other issues that we have is lack of modern equipment.
I'm going to interrupt you here, doctor, because we'll talk about this later on the Nigerian case. But back to the symptoms, I'm going to read out a few symptoms clients and other people who have suffered from endometriosis talk about. Some talk about vaginal spotting.
Yes.
Before menstruation begins, bowel symptoms like painful bowel movements, diarrhea,
constipation.
even constipation,
yes.
Sometimes, but very rarely, blood in stool.
Yes.
So you agree with that as well?
I agree. Other symptoms, like I mentioned earlier, could be painful urination.
Yes.
That could be that the endometrial tissue has gotten itself implanted close to the bladder or on the bladder. Sometimes it bleed into the urine, bleeding into the stool if the endometrial tissue has itself implanted in the rectum. Chronic pelvic pain, that's the major symptom.
That's crazy.
When we say chronic, longer than 3 months. So
chronic
this woman is just
ongoing.
having pain.
That's horrible.
Heavy pain every time she's on her menses, she's about to have during sexual intercourse.
And some can't get off the bed. They can't get off their bed. That's how painful it is.
That's how painful. Even longer than 3 months, back pain, they take one pain reliever.
And
it
then
goes temporarily, it comes back again.
It's like a vicious cycle.
Okay. Some vague symptoms could include headache, could include nausea, vomiting, bloating, dizziness. They are losing a lot of blood. So not just from one channel.
What do you expect exactly?
They are losing from many channels. So they will be so dizzy. They might be anemic, and then heart failure can set in because the heart cannot be able to accommodate that so much loss of blood that happens in endometriosis.
And infertility and repeated miscarriages.
Yes, infertility. I was about to mention that. That's very important. That's a major complication of endometriosis. What happens in endometriosis? Like I said, that particular abnormally implanted tissue starts to bleed. And so what happens after bleeding? There's inflammation. What does inflammation mean? It means reddening. It means swelling.
Exactly.
And then when she now actually stops menstruating, that place starts to heal. How does it heal? It starts to heal by fibrosis. It starts to heal by scar formation. Very thick skin starts to form in those areas in an attempt to try to heal. And then when that happens, blockages, obstructions, adhesions in the female pelvic organs are responsible for conception. So there's no way a woman can be able to be fertile or be able to get pregnant because of endometriosis, especially
So-
very severe endometriosis.
And sometimes it's not even reversible, is it?
Sometimes it's not.
Which is why we're going to take a break, a very short break, and we will be back, and we will give you more on how we can diagnose endometriosis and also what the treatments are. So we'll be back after the break. Stay with us with All My Life. We'll see you later.
Like me, shawty so bad, wifey, ride with me, ride with me, shawty so bad,
Why's my heart still palpitating when I know that I've been wasting time with you?
you like me.
Yeah. Really, all I'm trying to say is, you let me know this could really work. Don't take rejections too well. Don't send me back to my shell. No, didn't think I'd be this honest. I guess I just really want this, and I hope that you understand. I can't be forming like I'm the man. If you leave me, I go dig second guess. So please put me out of my distress. So is you gon' ride for me? I'm just praying that you make time for me. I can pretend that you don't get to me. Now I'm hoping that you gon' get with me. Yeah, I don't know how to say this. I don't wanna waste my time, but this a feeling. Yeah, I've been wanting all my life. I've been praying, praying that you be mine. I ain't trying to be faithless, but I've been wanting this all my life, 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 all my life. Praying that you be mine, all my life, all my life. I've been wanting this all my life, yeah, all my life, yeah, 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 yeah.
All right, welcome back to the show, and welcome back to the open case on endometriosis with Dr. Tochukwu Mekole. Once again, welcome back to the show, doctor.
Yep.
So where we left off, we were talking about endometriosis and its complications, and tell us more about the complications and one specific complication people might underestimate.
Yes, another thing I'd like to mention is the psychological implications of endometriosis. As a mental health advocate, I feel it's very imperative to talk about the psychological consequences of many medical conditions. And endometriosis is not going to be an exception. Depression. A woman who has endometriosis is very likely to fall into depression. How? Let's get the chain of events. A woman who has endometriosis, she has been told that she cannot have a child, she cannot get pregnant, she's infertile. And she knows that she's a woman, and she knows that as a woman, you have to, that's the thing about being a woman, you have to get pregnant, you have to bear children for your husband.
Especially how culture sees the woman.
Especially in the African setting. So she knows this. Peer pressure. She sees other women having 10 children, having 15 children. She doesn't have one child. She can get depressed from that. The husband, on the husband side, many African men, even till now, even till tomorrow, they still emphasize the need to have a male child.
Ah,
That's the thing, especially in my culture. We love male children.
same here.
So when you can't have a male child, you can't even have a female child. That can make a husband very, very upset. And because of that, there will be marital disharmony. There won't be any love in that marriage. There won't be any trust in that marriage. Your husband will be like, did I marry a man? Did I marry a witch? I'm sick of this marriage. I can't take it anymore. Even if the husband is actually patient, let's not forget the mother-in-law. This is Africa. Let's be practical.
You haven't
You
reached
married.
that point yet. When you get married, you tell me what it's like.
So my son married another man. My son married a witch. The next thing, go and marry a second wife. And then the woman gets depressed. And what's the next thing after depression? Severe depression, like we've talked about, suicide. So those are the psychological consequences
That's
of
the worst
endometrium.
case scenario.
Let's not talk about the painful sexual intercourse. Let's
Yeah.
not forget about that. That can put a severe strain on a couple's relationship, on a marriage. I mean, if a woman who is not, let's be practical, a woman who is not giving it to her husband, who is depriving her husband of sex, the husband is going to obviously get upset and say, what is going on every day? Today pain, tomorrow pain. What's the problem? I need to get close to you. And so that can put a strain on the relationship. Infections, PID, pelvic inflammatory disease, chocolate cyst formation. That's cyst that has some chocolate blood in them, chocolate looking like blood.
So you're saying brown, basically.
Brownish
Yeah.
in color because it has stayed for a very long time. Endometriosis
dried
for a
off.
very long period of time. Obstruction in the bowel, in the bladder, the adhesions that form in those areas, the scar tissue that form in those areas can block those channels.
You were mentioning, and this might be off topic, but that's something interesting for us to talk about. How men see their women, as in, you're supposed to provide babies, especially as culture. I come from a culture where also it's very important for the mother, the wife, to have a baby. But you feel that nowadays, with the exposure we have, with the education people are having more and more, especially here in Nigeria, I can tell you a comparison because I've lived here all my life. So I can notice a shift in how society perceives things they could consider taboo back in the days.
Yes.
Do you feel there's a slight understanding, at least, from men to or mother-in-laws or whatever towards women when it comes to infertility, that it's not necessarily taboo?
Yeah, yes, the thing is that's why we encourage men to be more concerned. This endometriosis, this topic, it doesn't just concern women, it concerns
The
men.
couple. And you
Concerns
notice
men.
it when
Yes.
you have your couples that come for and you diagnose
Yes.
endometriosis.
It's-
Do you notice that men are more involved in helping out in understanding their wives' cases?
Yes, more patient men are more involved in helping their wives. But I still think there's room for improvement. I want men to be more focused, to be more understanding, to realize that's why I want men to really, really listen to the topic, because they could have a wife, they could have a daughter, they could have a sister that has a condition, and understand that it is not something that is it's the fault of the wife or fault of the woman. It's something that happened, and there's really, really no cause. It's like I said earlier, it's a common but poorly understood condition.
Exactly.
So many professors, they have come and gone talking about this, that several theories have
come up.
regarding
And research,
endometriosis. I'd just like to mention one of them. We call that retrograde menstruation. What does retrograde mean? It means backward menstruation. So what this means is that due to the fact that the channel, normally a woman is supposed to bleed through the vagina and to
Exactly.
the exterior. But what that happens in retrograde menstruation is that there's like a blockage that doesn't allow the blood to flow out through the exterior.
Due
Instead
to
of-
endometriosis.
Due to endometriosis. So what now happens is that the blood now actually flows back again.
Wow.
And so those endometrial tissue present in the blood now start to implant in other areas that are not supposed to have endometrial tissue, leading to endometriosis. Cervical stenosis, that's a blocked cervix, can actually lead to that. That means the cervix that's supposed to take blood away.
Away. Yeah.
It's blocked. There's no channel to take the blood out. So the blood now has to go back again.
So all is
leading
piling
some-
back into the
so-
body.
Well, yes.
Mm.
Other theories are remnant Mullerian cells. Mullerian cells are female during embryologic development. The Mullerian cells are termed the female cells.
Mm.
So when they are still there, when they are supposed to have actually grown up, they are
and
still
differentiated.
there, differentiated. They are still there, so that can lead to extra endometrial tissue implanting in abnormally located areas. Other theories are metaplasia of coelomic epithelium. These are these are
Wow.
big terminologies.
But these are
Mm.
actually there. That's the thing. There are so many ways to diagnose endometriosis or the causes as well. And
Yes.
that's leading me back to my question. Why any woman can ask, why me? Why? Why am I a victim of this disease? Is there any specific cause?
Of endometriosis.
Yes. Other than, what you just mentioned.
Well, there's no.
Is it family related?
Well, there are risk factors
Okay.
for endometriosis.
So what would be the other risk factors?
Other risk factors, like you rightly mentioned, it's like you've been reading a lot about endometriosis.
I
Carla,
always
are you
read
sure? Are you
before-
sure you're not going
No.
into medicine?
I always read before my shows.
So you're doing excellently well.
Thank
You're
you,
doing
coming
some-
from a doctor such as
Yes.
yourself.
Yeah, you're doing excellently well. Genetics
Mm.
is a risk factor. First degree relatives, a sister or a mom that has had endometriosis,
All right.
you're likely to also have endometriosis. Early menarche. What does early menarche mean? Early age, the first age of menstruation. If it is so early, you're likely to have endometriosis.
Wow. Okay.
Okay. If it is also, if the period is very long, if the menses is also a very long, like if you're supposed to bleed for 3 days, you are bleeding for longer than
Wow.
7 days,
Okay.
that can be a risk factor. Also, if the cycles are very short, that means you are menstruating now.
Not every 28 days.
Not every 28 days, maybe 14, 20.
Mm.
Before you know it, you're
Okay.
menstruating
So
again.
twice a month you have your periods,
Exactly.
basically.
Some people say, or some researchers say, delayed childbearing can also
Oh.
be a risk factor. Also, other risk factors are defects in the uterus, in the fallopian tube, iron deficiency, anemia, and many other. But like I said earlier, these are just risk factors. These are not the main cause. We don't know the main cause of endometriosis. These are just theories. These are just reports. These are just researches that claim that these are the possible risk factors for endometriosis.
So these are like pieces of the puzzle.
Pieces of the puzzle.
All right. Okay. So are we going on a break?
Yes,
Don't do
yes.
the signaling with me. I can't multitask. Just tell me. Should we
Yes,
go on a
yes,
break?
we should go
Okay,
on
we
a
should
break.
go on a break again. There's more to talk about diagnosis. We spoke of this and treatment. Stay with us. We'll be right back with Wish You.
Health Station with Carla will be right back.
come closer, when you come closer, the feeling is real, make you rub shoulder. Oh baby, come closer. I don't wanna make me believe, say, me not fit touch you again, say. I just wanna do it all again, yeah. Me not come here to play no games, yeah. How do I make you see, say, me want fit touch you again. I just wanna do it all again, yeah. Me not come here to play no games, yeah. How you blow the patient, losing my mind,
All right, Day on Agoy with Wish You, love the song, and wishing you all a happy weekend to come. We are back to the show with Dr. Tochukwu Makole. Once again, welcome back.
Yes.
And we are talking about endometriosis, a lot to talk about, and we are catching up. We spoke about the risks, the complications, the causes, what it is. And now the next question to you is diagnosis. How would you diagnose that?
Well, the first thing is based on the symptoms. This woman in question has probably gone to see her doctor, told her the symptoms like we've talked about earlier: chronic pelvic pain, painful menstruation, heavy menstruation, and other symptoms like we've mentioned earlier. Now it's based, or it depends on the doctor now. He now wants to confirm, does this woman have endometriosis or not? First, you do a pelvic exam. You check the pelvis for any abnormalities.
All right.
You can also do an ultrasound scan. But the mistake many doctors make is that they do a pelvic scan
All right.
and may miss it. May
And you
actually
can miss it.
Yes,
Yeah.
you can miss endometriosis if you just do a pelvic scan. It's important for you to do a transvaginal ultrasound scan that will
Okay.
help you visualize the whole female reproductive tract on the pelvic organs, the female pelvic organs in great detail. Laparoscopy. Laparoscopy is the best. It's the most accurate,
right?
Yes,
Yeah.
it's the most accurate. It's the primary diagnostic modality for confirming endometriosis. Although it's invasive, a surgeon will have to just make small incisions
To
and-
retrieve a bit of the tissue as well.
yeah,
maybe
to use
do
a laparoscope. He uses a laparoscope like a visual aid to check for endometrial tissue,
Yeah.
collect the samples,
for biopsy.
and for biopsy and histology to visualize the cells.
Okay.
By the time he sends that for histology and then sees that these are endometrial cells, then it just confirms endometriosis.
Okay.
Laparoscopy helps us. It determines the location, the extent, and the size of the endometrial tissue. So that's why it's actually the best, the most accurate. Other diagnostic modalities are MRI. Very expensive, but yet it can be very, very useful in confirming endometriosis.
Yeah, I was going to say it very expensive, I'm sure, especially we're going to talk about the Nigerian case soon enough, but how can we relate this to here? How affordable, how accessible it is? But this is coming up next. But now we know that, okay, you can diagnose it and you can treat it, I guess, right? If it could be reversible if caught on time, what would you say?
Yes, it's if caught on time, it can actually be reversible. Fertility can actually be preserved if it is caught early. But when we have endometriosis that has been there for long,
Yeah.
that has been missed, that hasn't been taken seriously, the complications are not funny. The complications will always be so much and be so permanent. So that's why it's important for us, like I always mention on my page, on my videos, early detection. They say prevention is better than cure.
Definitely.
Whoever made that comment wasn't exaggerating. Prevention is always better than cure. When you detect things early, it's easier.
The treatment
it's
is
cheaper
easier.
to
Definitely.
prevent
Oh, yes.
than when you're now going up and down
Definitely.
trying to cure the condition. Prevent it by diagnosing on time.
And checkups,
And
I
check
guess,
it,
because
checkup.
people are afraid of going for checkups most of
Yes.
the time. You agree with me on
Yes,
that?
I advocate that people should go for medical checkups every 3 months. That's what I advocate. To run tests, to do several tests, several investigations to check how they are doing. their health status and all that, I advocate that they go every 3 months. But of course, this is Nigeria. Let's
Yeah.
be
Especially-
practical.
Yeah, especially if you've got history in the family of, let's
Exactly.
say, something specific. At a
Something
certain
specific.
age, you have to.
You have to check.
take it seriously.
Mhm.
So we're going from it. Treatment can go from pain medication, as you said, to surgery, depending on the case, right? And hormone replacement therapy, maybe.
Yeah, treatment options. I will divide them into 3 so that we can
Okay.
all understand.
So let's.
We have medical or hormonal treatment.
Mm-hmm.
We then have surgical treatment, and we then have symptom treatment. That's the use of pain relievers.
Oh,
So
okay.
medical treatment or hormonal therapy, that's the use of combined oral contraceptive pills
Mhm.
and gonadotropin releasing hormonal analogs and danazole. These are medications that help to, well, control the symptoms of endometriosis. The important thing is that patients should be encouraged to take these medications for 6 months. That's the full course. So they should be encouraged to make sure that they complete that full course therapy. Otherwise, there's always going to be reoccurrence of the particular symptom in question. Symptom treatment, use of pain relievers, NSAIDs, ibuprofen.
That's the most common.
Yes, non-steroidal anti-inflammatory drugs, ibuprofen, diclofenac. They help to relieve the pain. If the pain is so severe, narcotics can
Oh.
actually. I've seen patients who have had so severe pain in endometriosis that they will have to have a narcotic, and there's always the fear of drug addiction in narcotics. So, but it can help with the pain. Now, surgical treatment, that is the most permanent, really. It helps to it completely cures endometriosis, if we want to put it that way. This surgical treatment is also divided into 3. We have conservative surgery. That's just endometrial ablation. What that means is that the endometrial tissue where they are seen and then removed through surgery. The adhesions, the scars, they are all removed
Everything
through
is removed.
ablation.
It's cleaned
And
up, you could
yes.
say.
And then one mistake many people make is that after the surgery, that's the end. You still have to take the treatment, the
Treatments.
drugs,
to avoid coming back.
to avoid reoccurrence for 6 months. Let's not forget.
Wow.
Then we have semi-conservative surgery. Let's not forget that in conservative surgery, that's endometrial ablation, fertility is still preserved. The woman can actually still get pregnant, especially if it's detected early of the surgery, or the surgery is done very, very early.
Okay.
But in semi-conservative surgery, it's a bit more severe, and in that case, the uterus is removed.
Completely.
Like-
Oh my God. So there's not turning back. That's
yeah,
it.
but the ovaries are left.
All right.
Okay.
Okay.
But the worst is just radical surgery.
Yeah.
Both the ovaries and the uterus are removed. Why
Wow.
are they removing the uterus? Because that's where the endometrial tissue is coming from. So you just have to remove it so that it will not get itself implanted in areas that are not supposed to have endometrial
Definitely.
tissue.
So every case is different then.
Yes,
You
every-
can't just give a one rule of thumb that this is what everybody who has endometriosis
Yeah,
should do.
Yes, it depends on the severity. Of course, a woman who has mild endometriosis, you won't go and say she should go and
Exactly.
remove her womb and ovaries. I don't think the
Definitely.
woman will even agree to do that. You have to, that's why I say, you, as a doctor, you have to be observant. You have to have, also have a high index of suspicion. You have to check, is this really necessary? So that you don't, because of medical legal cases.
Definitely.
I mean,
And expenses as well for the
legal
patient.
cases, the suits that could happen if you remove a woman's uterus
When you
and
didn't really
ovaries,
need
a
to.
very precious organ of
Oh,
a woman. You
definitely.
remove it
Yeah.
and you don't really need to. So you have to be sure, am I doing the right thing? And it has to be the patient or the woman in question has to agree to the terminologies of the surgery.
Well, that's quite clear, and we will be opening the lines for more questions to come, Dr. Makole. So for whoever wants to call us, we will be opening the line soon. 012770991, 012772991, 012773991. You can always also leave comments on our Facebook page, Nigeria Info 99.3, where we are streaming live. And we will have more on that. But for now, we are going to go on a very short break again. And we'll be back on the Nigerian case, why endometriosis is a problem here in Nigeria. Stay with us.
So when you know word in the street is that
It's KD.
I caught you all my plans.
back, and we're back at the last part of our session for today on endometriosis with Dr. Tochukwu Makole. And we spoke of what endometriosis is, the risk, the complications, the causes, the diagnosis, and the treatments. So much to say, so much to share. We will be opening the lines right now: 012770991, 01277 1991, 01277 2991, 01277 3991. And please do leave comments if you can't get us on the phone. We have a comment right now coming. I can't read the screen from here. Dipo, you're going to help me out with the first question. But
Yes.
before that, before reading that, let's talk about the Nigerian case. We did start talking about this before at the beginning of the show. Why is endometriosis a problem here in Nigeria? It is a problem. This we agree on.
Yes, I agree. Yeah, so many medical experts, they believe that patients who suffer from endometriosis, they are usually misunderstood. They are misinterpreted. They are not taken seriously. If you have watched my video that I posted not too long ago on endometriosis on my Instagram profile page, I talked about a woman who had symptoms of endometriosis. Painful urination, painful menstruation, heavy menstruation, painful sexual intercourse.
Everything.
But it was not recognized on time.
Wow.
Why? So many misconceptions. Many people believe that the severe pain encountered in endometriosis is normal. I mean, you're just having normal menstrual pain.
So
You have pain during your menses. That's normal. Just take Panadol and it will go down.
That pain
Then-
is not normal. Sorry, I'm going to interrupt because we're taking calls at the same time, Dr. Makole, all right? Hello?
Hello.
Yes, good morning.
Good morning.
Yes? Who's on the line?
I want to remain anonymous.
All right, sure. Would you like to ask Dr. Makole any question?
Yes.
Please go ahead.
Okay, I want to know if a woman cannot conceive for a period of time, will it be the result of endometriosis?
Okay.
So if a woman can't conceive in a
Yes.
period of time, would that woman be maybe having endometriosis? Go ahead.
Yes.
Like I said, it depends on the symptoms. We have to look at the symptoms. It depends on the symptoms this woman is having. So many things can cause a woman not to get pregnant. Endometriosis is just one of them. There are many other things that could cause a woman to get not to get pregnant. Hormonal imbalance, pelvic inflammatory disease, even fibroid.
Hello, doctor.
Yes, sir.
She usually have irregular menstruation, stuff like that.
Okay.
Irregular cycle,
Okay.
Yeah.
menstrual cycle. All right.
Like once, maybe in 3 months, the thing will surface. After that, it don't come again.
Mm.
Okay. You
I-
can hang
I-
up now and he'll answer your question. Thank you.
Okay, thank you.
Go ahead.
Yeah, I understand what you mean by irregular menstruation.
He means irregular.
Yeah, irregular.
Yeah.
I said irregular.
Yeah,
That
irregular.
once in, I think he said 3 months.
3 months,
Once in
yeah.
3 months, yes.
If I heard correctly. So, like, it's still the same thing. There are several reasons why a woman can have irregular menstruation. And one of them, off the top of my head now, could be hormonal imbalance and pelvic inflammatory disease. So, it may not be endometriosis. Like we talked about, diagnostic modalities are very, very important. High index of suspicion, too, is also very important. So you don't want to label somebody to be having endometriosis when the person doesn't actually have endometriosis.
So you would advise they actually go to a healthcare
A health-
practitioner.
yes, a
and
healthcare professional. You can come see me. I'm always available.
Why don't you give your number right now so they can know which hospital you are at, doctor?
Okay, my phone number 070
Yeah.
65 61 60 52.
So 070 65 61 65 2. And where do you practice?
Okay, I work in a private hospital, God's Apple City Hospital, Ojodu Bega. It's
All right.
off Olalake Taiwo, off Aino Street. That's where I work. It's a private hospital, very well equipped hospital.
I'm sure for you to be working there, I'm sure it is.
Yes, it's very
So back to our discussion about a patient you had, the lady.
yes, as I was saying.
We might be interrupting this as we get the calls.
Oh,
if
there's
you
no
don't
problem.
Mind. Yeah.
This woman had, like I said, some people believe that the severe pain is just normal. It's a normal symptom of menstruation without knowing that it's actually a call for help. This person might have endometriosis. It's usually overlooked. Some people also believe that it's hereditary. It's a family history thing. Oh, your mother had it.
But it is as well. You have it in the family.
It's actually correct.
Yes,
But people take it for granted now.
that's for sure. Don't
Yeah.
marry her because her mom had endometriosis and couldn't
Exactly.
get kids. So don't marry her. She won't bear you any child. Is that
Or
it?
saying something like, well, your mother had it. She went through it. She survived it. Why can't you?
Oh my God, yeah.
She took herbs. She took herbal concussions. She's fine. Why can't you?
We have a
Sorry,
phone
I'm
call.
interrupting again. Hello.
Hello.
Yes, good morning.
Morning. Greetings to you all.
Greetings to
Greetings
you.
too.
Thank you so much. Please, I would like to ask Doctor a question.
Sure.
Thank you. A lady that is pregnant and she saw her menstrual cycles and she now did a test. And after a while, she could not go for infection treatment. So, after well,
Oh my God.
Oops.
Please call again. It just got caught. We didn't get the whole story, right? Please call again, whoever it is you are. Thank you for trying. Please go ahead, call again. Let's continue your story.
So other misconceptions. Well, I won't say misconceptions. Let's say myths.
Yeah.
Hereditary, family history thing. Your mother had it. Others are delayed childbearing, like we talked about.
Yeah.
Not being able to marry on time. So people label it to endometriosis.
So if
that
you-
when you get married, the symptoms will stop.
Okay.
It's a misconception. Sometimes even when you get married, symptoms might
Don't
not actually
stop.
stop. Other misconceptions are lack of modern available facilities to be able to diagnose the condition. Sometimes it can even be aggravated because there's no modern medical equipment.
And I think that's the main problem here in
some
Nigeria.
parts of Nigeria.
Access to
Access.
for the amount of people. We're talking millions of people, a population of millions.
Millions.
To have access financially or even geographically. I mean,
For example,
Carla, we have a call now.
sorry,
so
we have
let's-
another caller. And then we are going to be answering whoever it is that posted a comment on
on
Facebook.
Facebook.
Hello.
Hello. Hello, good morning.
Yes, good morning.
Yeah, my name is Frank. I'm calling from Yaba.
Hi,
Okay.
Frank. Go ahead.
Yeah, I just heard him, trying to downplay the importance of the herbal remedy. Is he trying to say that there's no herbal remedy for painful menstruation? Is that what you're saying?
Herbal remedies. Are there any
Yes.
herbal remedies?
as a doctor, I will not advocate or encourage people to take herbal medications to
Without
treat
consulting a doctor, at
very
least.
serious conditions. Let's not forget the contents of these herbal medications. Some of them contain very awkward constituents. Some contain alcohol, some contain very weird substances, which I don't know the credibility. I don't know what is in all these
Each.
herbal
And where they get
medications.
them from
So
as
I
well.
totally discourage it because I don't know.
Of course.
That's not to say that you cannot take fruits and vegetables. You cannot take things that are known to make you more healthy.
In the contrary, your
Yes,
diet has a big
yes,
influence.
Yes, I'm not saying that you shouldn't go herbal. If any
course.
herbs, I'm not saying
Yeah.
that. But when we're talking about serious,
Treating.
please just
Yeah.
go to the hospital. It's not
Exactly.
far. It's not accessible. Mine is not far,
And
so you
then-
can come see me before you start taking herbal
Definitely.
concussions.
Then it might cost you more if you've had damage done because of taking any kind of herbal drink you were told.
It might
was
even make it worse.
worse.
It might aggravate
Exactly.
the situation.
So 07065616052 is the way they can contact you, and then you can give them the address.
We have just
Uh,
5 minutes left.
All right, let's just take that question on Facebook.
Okay, so Raphael Adegoke is asking, is it true that late childbearing is a contributor to having fibroids? Yeah.
Yes, it's true. It's a risk factor. That person must have been reading really, really well.
Well done.
It's possible because what happens in fibroid? Sorry, are we talking about fibroid
Yes,
and
here now.
endometriosis?
Now he's going
That-
about
that's
fibroid,
what
but there
he-
is
that's
a
what he's
link
asking.
sometimes,
Yeah,
right?
there's a link.
One can lead maybe on a longer
fibroid.
one.
What happens in fibroid is that the muscle of the muscle starts to swell up.
Yeah.
And then form a tumor and form a swelling. That's what is referred to as a fibroid. It's becoming a bit more like the muscle becomes a bit thicker due to excessive endometrial tissue. So that's what happens in fibroid. So the muscles become thicker. So that is similar to endometriosis. It's like saying something that is overdoing
Exactly.
something.
You have something extra there that's not
Extra
supposed to
that's
be
not
there.
supposed to be there.
And
So-
late childbearing does.
Yeah, so late childbearing, when you are always menstruating, you are just menstruating. You don't have any break.
So-
Pregnancy will make you have some sort of break.
Ah, that's
So
why.
this thing.
Okay.
So you're just menstruating. That can be a contributing factor to fibroid and endometriosis too.
Okay.
Yeah.
Thank you for contributing on Facebook once again. You can always leave comments later on, and Dr. Macaulay can answer them later on our Facebook page. But for now, we are going to have to end our session. Time flies very quickly when we're
Okay.
enjoying it.
Yes.
One
yes,
more
yes.
time, how they can reach you, where, and your Instagram handle, Doctor.
Okay, 070 65 61 60 52. That's my phone number. You can reach me on WhatsApp. My Instagram profile page at Dr.TM, Dr.TM_ the medical truth. That's my Facebook page is at, in block letters, DRTM, the medical truth in small letters. And you can reach me on many social media. Don't forget to watch my videos
Definitely.
and comment and ask questions. I'm a very good listener. Everybody knows me. I listen, and I listen good.
And you're a very
I'm-
good doctor, too.
Yes, and I tell the truth.
The medical truth,
Yes,
as you
I
say
tell
it.
the truth,
Thank you
yes.
so much for coming. Thank you
yes,
so much. Really,
I'm
it's
very
been a
happy.
pleasure. I
Yes.
look forward to other topics we can open.
Definitely.
Specifically for the Nigerian case here. We will leave you on a quote of the week by Monica Bellucci. Once again, thanks for coming, Dr. Macaulay. Depo, as always, it's a pleasure.
Yes.
I will leave you with Monica Bellucci, and this is what she has to say, and it's a thought for the weekend. Beauty is a gift, just like good health or intelligence. The only thing is not to be proud of being beautiful, because you didn't do anything. It was given to you.
Okay.
Interesting.
Interesting.
Be humble in life. That's what I'm trying to say. That's the message to come across. Endometriosis, a lot to talk about. We've learned a lot for today. Thanks to you, doctor. We'll see you again for another show. And for now, have a blessed weekend from the Health Station.
That was Health Station with Carla. Make it a date next week, 11 a.m. to 12 noon. More talk, news, and sports after this.